Hi, I'm John. I'm one of the orthopedic physios here in the Western Trust, and this is the third video in our ACL post-op rehab series. At this point, we're moving from weeks 4 to week 8. After going through the first two videos, you'll have an idea of how to get the knee moving, how to get it straight, how to keep it straight, how to manage the swelling, and how to start working on a good efficient walking pattern, and also commence some cardiovascular exercise. From here, we want to develop that further. We want to continue to keep the knee straight. We want to develop the strength in the quads. We want to work on range of movement, how much flexibility we have in the knee if we're still lacking a little bit of that. We want to progress the strength of the whole limb and start to work on balance in addition to what we've covered so far. So moving forward with the range of movement work, you'll continue to do what you've done in weeks 0 to 4 and try and do that on a daily basis. We want to get good control throughout the range of movement. We want to continue to develop our balance and also work on our cardiovascular exercise throughout the process. On a strength note, we're going to move more towards more traditional strength exercises such as variations on the squat, the deadlift, the heel raise, and so on. We're going to start introducing hamstring strength. That will vary depending on your graft type, be it a patella tendon graft or a hamstring graft. You'll be given guidance on which graft type you have and when to commence formal hamstring strengthening if you have a hamstring graft. Outside of that, we want to work on good quality movement. We again want to make sure we have a quiet knee. When you're working through these exercises, 3 out of 10 on a pain scale is acceptable. If you go beyond that, reduce the intensity or reduce the volume accordingly to allow you to continue to work. If you find the following day after exercising that the knee is swollen up, just reduce the volume and reduce the intensity by about 50% and build it back up again gradually. If you have any difficulties or any questions, please liaise with your physio and we can advise as we can. We continue with our static cycling with no resistance to begin with, then gradually on to light resistance. Keep the cadence smooth and keep the saddle at a decent height. We carry on with our wall stride exercises. Imagine you're squashing an orange onto the mid to forefoot. We're not fully locking out the knee to feel the tension in the calf and hamstring. Now we progress onto our wall-based front squat drill. You can see our toes are against the wall. We keep our hands at head height or higher and we try to descend to the chair as slowly as possible. You may well get so far and then need the chair behind you. It's there for safety. We want to progress to moving slowly down and slowly back up. If you're unable to make it all the way down and up, try holding a light weight against the front of your chest as shown to counterbalance you as you come down. We want to then move into reps of front squats off these patterns. If the high held weight doesn't help, try a lower hold and weight as shown. You can progress from light weights to kettlebells or a backpack with a few books in the house if you don't have weights available. From here, we want to start working on our wall sit position. Here you can see the thighs are 45 degrees to the floor and we have the back flat against the wall. Once you can hold it there for a minute, then you progress down to just above 90 degrees as shown. Once you can hold it for 1 minute, with 1 minute rest 3 times, we move back to 45 degrees from the floor and we progress to one leg. Tilt the tailbone away from the wall to flatten the lower back against the wall. We need a vertical shin on this exercise to feel the effort in the quads. Once you can hold it for 3 rounds of 1 minute, you then progress down to just above 90 degrees on one leg as shown and repeat the process. At this point, we want to start loading up the hamstrings a little more. Here's a split squat RDL as shown. We want the weight through the middle of the foot. We want to keep the heel and the toes on the floor and pushing the hips back. If that's difficult, we can regress to the wall as shown. And we're pushing the hips back, keeping a nice neutral shin angle and bringing the hips forward to finish. From there, we can progress onwards to a single leg RDL. We want to keep our hips square. You don't want to see that trailing leg hip rise into the air. You can use upper limb stability or holding on to something if you need to. From there, we progress to a weighted RDL as shown. It's all about the hips. Push the hips back and pull the hips forward, keeping the weight through the middle of the foot. Now for the quads, we want to look at a split lunge. We need a vertical shin against the chair as shown. We want to be at 90 degrees at each knee in the starting position, and you're pushing through the rear leg, which is the operated leg, to get up into the air. To progress the quads further, we want to go into the knee extension position as shown. We put a gym ball against the wall and we push as hard as it is not painful to try and straighten the knee into the ball, and we hold for 10 to 15 seconds over 5 reps. We can then open it out to 60 degrees as shown. Again, we're pushing as hard as it isn't painful for the prescribed time. We can also add in a closed chain leg press into the gym ball. Please take care to make sure you don't push the chair back into a tipping position and the ball is secure in the corner where it will not move from side to side. We begin to push on with calf strength. We want to work on our calf raises as shown. We must ensure we're moving upwards and downwards and not rocking the hips back and forth. Once you can hit 20 to 25 reps, we can start progressing on to single leg calf raises. The goal is between 20 and 25 reps. At this point, we can start working on restricted range knee extension. You can see here we're going from 90 to 45 degrees with a light weight on the ankle or a light band tied to the back of the chair. So to summarise weeks 4 to 8, we're working on getting the knee straight, keeping the knee straight, looking after the swelling, walking very well, and we're starting to build on our cardiovascular exercise. Aside from this, we're starting to develop more strength work. We want to focus on the quality rather than the quantity of our exercises. Technique is very important. We want to have a vertical shin for our split lunge exercises and our wall sit exercises to target the tissues that we're trying to strengthen. We want to operate in and around a 3 out of 10 pain score for exercising. It's okay to feel discomfort when you're working through this stuff. If you feel more than that, just lower the intensity or lower the volume. If you find over the next 24 hours that the knee gets more swollen, it's likely we've just done a little more than it wants to, and we need to reduce the volume or reduce the intensity. We don't stop altogether unless there's been a trauma or you're concerned, in which case speak to your physiotherapist. Outside of that, you've got some targets to aim for, you've got strength work to look at. The squat pattern is very important. If we don't equalize how well we're taking the weight in a squat, the body can offload the operated leg for up to 4 to 6 months after an ACL reconstruction. Focus on good even weight bearing across both legs. The wall sits and front squat wall drills will work very nicely with this, but it's important to train the other leg whenever we're doing our single leg work as well. What they call a crossover training effect will help the operated leg by training the other leg. And when we come to do our 3-month, 6-month and 9-month testing, we compare one side to the other. And it's important that we don't let the non-operated leg become deconditioned during this time. So have a go at those, work through them. If you have any difficulties, liaise with a physiotherapist for further guidance.